Welcome to the Q. My name is Lisa Maroney. I am the Director of Business Development for the town of Chelmsford, and we're back here with another great episode, very helpful and insightful. Lots of useful information that's coming your way from our special guest today. But first, I want to welcome back again my co-hosts, Jen, Darcy, and Karen. Hi, girls. Thanks for coming back.
Hi, nice to see you.
Thank you. My colleagues, my coworkers. Sometimes I like to call you my friends, but here we are with another Q episode. And welcome to Remedium Pharmacy. Thank you so much for joining us today. It's great to have you. And we have so many questions to ask you on the Q. What kind of an extraordinary time to be talking to a pharmacy post-pandemic as we try to come out of this COVID experience that most of us weren't prepared for, but we have all come together for different reasons, and it's just been great to create something like this together. And I'll just hand it over to David. Introduce yourself, and then we'll chat with Amy.
Thanks, Lisa. My name is David Palmerino. I'm with Remedium Pharmacy. Just a quick overview or background of Remedium Pharmacy. We've been in business for about 6 years, right in Vinyl Square. I'm sure you're all familiar with the area. And we were just talking earlier about, I think we have something like 100 years of pharmacy experience among all our pharmacists and techs. So we've seen it all. We've done it all. But we are locally owned. And as I said, we have about 25 employees. We are a full service pharmacy, which means we can handle any type of prescription that you have that's written for your patient, for you. But we also specialize, more importantly, in compounding. The compounding is really important because nowadays, instead of the general medication that tends to work on the body itself, we can target and actually customize the medication to help the patient with the condition that they have. So that's important to know too. And compounding is really, it was sort of, and Amy can speak more to this, but sort of was a lost art. And I think it's coming back, which is important, which is a great thing. But as I said, I think what we want to focus on at this point with the Q today is really getting the people to understand the need to vaccinate, especially in obviously in light of the pandemic. The more we can vaccinate, we can stop the spread of COVID, hopefully. So that's our goal.
Great. We're here to help with that. And thank you for participating. We are very proud to have your pharmacy here in our town. And, you know, we're here to support you as well. We're here to serve the municipality. So great to be connected. And then let's turn this over to Amy for an introduction. Thanks for joining us, Amy.
Hi, thanks for having me. My name is Amy Donovan. I am a pharmacist with Remedium Pharmacy. I've been with them for about 2 years now. I've been a pharmacist since 2001, so a very long time, and working in pharmacy since 1995. So I've seen a lot of changes over the years for sure. So as David spoke to, it's true. It's amazing what has come back and how it's come full circle. It used to be all of pharmacy in the olden days was compounding and, you know, specially tailored medications. And then it became very commercial. And now it's coming back to, there's so many advances that we can, you know, especially tailor certain formulas to what patients need. And that's amazing. So that's really great. And it's something I've been very lucky and excited to get involved with here at Remedium. As David said, we are working now to really open up our vaccinations, and right now we're doing COVID, and we're hoping in the fall and future seasons to be doing other vaccinations for the community as well.
I can't believe that you're able to offer that customized, specialized service, and that the Remedium Pharmacy has survived the commercialization of pharmacies. I grew up next to a privately owned pharmacy, and I remember it so well. Just it was first name basis, and it's just wow. I can't believe that's still here in Chelmsford. It's pretty unique. Really appreciate that. And so the people here with us, the public nurse, Jen is community services. Karen owns a small business with a specialty service for people of maturing age and special, medical needs and things like that. And I had no idea that you offered that compounding, aspect of your business. I don't know how I would think about that otherwise, but maybe, you know, I know Jen has some experience in some of this as well. So I think I'm going to ask Jen to add some comments and share a little bit from her perspective.
Yeah, thanks, Lisa. So Amy and David, as Lisa said, I'm the community services coordinator here and I'm a social worker. But previously I worked in healthcare for 20 years. So I'm very familiar with pharmacies and how they function more on the hospital end of things. But I was hoping maybe, you know, my question is sort of twofold. Maybe you could give us like a brief rundown or introduction to what compounding actually is for our folks who don't know what compounding is. And then what I'd really like to know is how the pandemic has impacted your business and what you've sort of done to, as we move out of that, to kind of, you know, stay afloat and what you hope to look towards for the future.
Sure. David, you want me to take?
Go right ahead.
Take the compounding part, we can go from there. So basically compounding, in a sense, like I said, is when you have a tailor-made medication based on what would be specifically needed for the needs of a patient. So we work with a number of different physicians in the Chelmsford and surrounding areas. We work with dermatologists, we work with podiatrists, we work with veterinary clinics. We do a lot of pet meds as well. Pain creams, people who have neuralgia and other types of pain that might not be well controlled or might not be able to be controlled through oral medications for a number of different reasons. Topical medications can sometimes be a great option because you don't run the risk of as many side effects, interactions with other medications that they're taking for other medical conditions besides for pain or other reasons that they're using the topicals. Veterinary medicine, again, veterinary medicine can sometimes be very hard to come by. Pets that need specialized doses, small animals. We have some ferrets. We have cats, dogs, bunnies. So I mean, again, things that you might not even think of that we can do to be able to get them the doses that they need based on their medical conditions. And we have a great community. They take very good care of their pets up there. So they really want to keep them going for a little bit longer. That's really what compounding is about. A lot of children's medications as well. I know myself, my children, when they were younger, were very hard to get medication into. So we can compound specialty medications in doses that are appropriate for the child's age and weight, for different medical conditions that, again, they might just not be commercially available in the doses that are needed for those conditions. So a lot of open area. And if it's something that we don't necessarily make, we will figure out how to make it. So if a doctor calls us and says, we have this patient with, X, Y, or Z need, what can you do to help us out? We will do a lot of research. Our owner and head compounder, Christina, she is amazing. She has a lot of experience training with compounding, a lot of certifications, and she will really go to the ends of the earth to find out what she needs to get something done for a patient. So been very lucky to train under her, and I'm just hitting the tip of the iceberg because it's really such a big area of interest and of things that can be done with it. So it's a great service to be able to provide. As to the second part of the question that you asked, as far as what we're doing pandemic, post-pandemic, and during, I would say overall business has, remained very busy for us. A lot of the communities that we serve, Lowell, Chelmsford, Lawrence, and all the areas surrounding that, we have a very big patient population who either don't drive or don't necessarily have access to the pharmacy. We offer free home delivery. We have a great staff of drivers who will get the meds to the patient same day if need be. We do compliance packaging, again, for the Visiting Angels, I think it was, Karen, that you were a part of. A lot of visiting nurses work with us. We have a lot of patients that they'll call up and say, listen, I'm having trouble with my patient. They're not compliant with their meds. How can we help them out? So we get them set up on blister packing. We work with the nurses to try to get those meds out to them, on a monthly or bi-monthly basis, whatever the need may be. So, and then obviously just regular prescriptions as well. So anyone can come in, fill a prescription, a one-off prescription, or get their monthly meds with us as well in regular vials. So we try to really kind of service, all of the needs of the community.
I find that so impressive. That's not anything what I thought happened in a small locally owned pharmacy. that's just amazing. I've just learned so much. I already scratched off the questions I had because you just
Oh.
answered a lot of that. So really, that's really great. Thank you so much for the education of it all. And, you know, with myself being business development, I'm wondering if David has any thoughts on that regard in terms of how Remedium Pharmacy works in terms of the business community, what I can be doing better for the pharmacy. I haven't been overly connected with the pharmacy. I've been doing a lot of small business stabilization and retention efforts, things like that. But any thoughts or comments from you, David, on how I can better assist you or this team that's here today with you?
One of the goals, and again, thank you for having us. One of the goals for today was to get to understand, have everyone in the Chelmsford, as Amy was saying, in the Chelmsford and surrounding towns, understand who we are, where we are. But the next step was really to promote the idea of the vaccination. And one of the things you can help us with is promoting the idea of one of the things that we're going to do. In fact, we have done already with school systems and some of the businesses in the area, is actually setting up a clinic in their location, in the business or in the school system, in the actual school system, where we can vaccinate the children, the kids. We do offer the 3 vaccinations, the Pfizer, Moderna, and J&J. And of course, with the Pfizer, as young as 12 years old, and we've done that with the school. We literally will go into the school system. We'll set up a clinic in the cafeteria. Amy is the head of our clinic for that. And we just want to vaccinate everybody we can, you know, kind of help our corner of the world, if you will, and kind of conquer this. And so you can help us with that. You can reaching out to the businesses. We'll go to the businesses also in the area. And as I said, set up a clinic right in their lobby, right in their a private office somewhere, whatever's easy for them, making it as convenient as possible to go to their place to vaccinate. You'd love to be able to try and do that for them.
I'm going to put Darcy on the spot. Darcy,
I was just going to say the same thing.
as our public health nurse, do you know what the latest numbers are in Chelmsford as far as percentage of population vaccinated?
Chelmsford we're doing really, really good. I want to say in the high 60s, 70s is the last time I checked. Massachusetts on a whole is high 50s, low 60s. I mean, so we're doing good. And, you know, I really think bringing the vaccine to people it's huge. It's monumental. I think it's going to really help bump those numbers even more.
Sure.
Reason that we're able to rescind a lot of these mandates and safety standards is because the vaccination rates are so great in Massachusetts. So we're all doing such a, you know, good job trying to get it out there. And you know, this is just another tool in our tool belt on getting everyone vaccinated and the pandemic behind us would be so.
Absolutely, that's the goal. Just
That's the goal.
just to jump onto something Darcy just said about, you know, bringing the vaccine to people. We, in addition to what David had said, we can set up clinics anywhere. We just did a clinic last week, as David mentioned, at Chelmsford High School. We vaccinated about 75 high school and middle school students, so it was open to them. And we put that together literally in like a week turnaround time because they wanted to get it done before school was out. And we're going to be headed back there in a couple of weeks for their second doses as well. And hopefully maybe we'll get some more people, you know, walking in due to the, you know, them talking about it in the school system, even if they want to come for their first doses and come to the pharmacy for their second. But Darcy mentioned about bringing the shots to people. We have also done a number of home visits with some of our housebound patients, myself, Christina, a couple of the other pharmacists as well. We're more than willing to travel to the surrounding communities. For Karen, any of your patients that, you know, might be an issue, we can definitely go there and do the vaccine right at their home. We have had some patients that we've done that for. So I think the key is just, you know, letting people know that, you know, one, we're there, not only for vaccination needs, but for anything that someone may need, that they need a little bit more specialized service. I worked in retail, in a regular retail setting for basically most of my career. And with all the changes that I saw over the years, the one thing, I mean, I love retail pharmacy, but the one thing that I disliked was how it became very commercialized, and it took away from that patient pharmacist relationship and really, you know, caring about your patients. And they didn't give you necessarily enough time to be able to do that. And fortunately, we have the luxury of that at Remedium, where we can really get involved with our patients, be able to maintain those relationships and, you know, really know them, know their nurses, know what they need, and they feel like they're really being taken care of versus just kind of being shuffled in and out. So we really pride ourselves on that there.
I'm sure that's what makes you so successful and why you've been in business for so many years, by making that a priority, you know?
I
We
have a
we're very
follow-up
lucky.
question for you, David. Just going back to what you said about having all 3 vaccines available. You have Pfizer, Moderna, and J&J. I was curious. First of all, I hadn't heard of any pharmacy actually having all 3, so I think that's fantastic. Are folks able to choose which vaccine to get from you? And the reason why I ask is actually a little bit personal. My family has a very rare genetic immunodeficiency disorder, and there's one vaccine that our treating immunologist recommends for us over the others. And so it took a little bit, I was vaccinated very early, as were a couple of my children. It took a little bit to try to find where we could get that specific vaccine, because it was sort of hit or miss, where you were going to get vaccinated. So I see from Amy nodding that folks can choose which vaccine they want.
They can. David, do you mind if I take
Please,
this on?
right ahead. Sure.
Okay, so if on our website, first of all, anyone can call at any time. We're also accepting walk-ins at this point now. Obviously, at the beginning of our vaccinating, it was, like you said, hard to get all the vaccines. We started with a couple, and now we're, very grateful that we have all 3 in stock, and we have a hearty supply of them to be able to, set up the clinics and be able to serve walk-ins as well as need be. On our website, we have a link where you can sign up for an actual appointment for the vaccine. And when you select that option, it will ask you which one you are looking to get. Also, I think it'll show, if you search on any of the mass vaccine finder, it'll show that we have stock of all 3 in stock as well. And when they call, they can just ask. So yes, absolutely. It's nice now that we have them all, because we've got a lot of questions early on. Do you have this one? Do you have that one? And again, for whatever reason, patients have their preference as to what they feel or what their doctors have advised them to get. And it was hard at first to say, no, we don't have that one yet, but it's coming, and just waiting for it to come down. So we're really happy to be able to say that we have that option now.
And of course, just recently, being at the high school, we only offered the Pfizer because that's the only one that's allowed for emergency use authorization at this point. Hopefully, we'll see what the FDA and CDC allows in the coming weeks, if they lower that age, or if they approve the others for lower age as well. We'll see. But we can vaccinate anybody who's possibly allowed to be vaccinated. So we can take care of all that.
So Karen, any comments or thoughts in regards to what you're hearing? And I know you've had some support with Visiting Angels for home visits, things like that, but any feedback?
So this conversation has been really enlightening for me. I love that there's a local pharmacy that we can depend on. Amy, your background is really beautiful. It's just like, I would just feel great walking into your shop and just that feeling of this local pharmacy that really knows me. I feel like you guys are a very valuable resource for me. We have seniors who are homebound that we have caregivers come into their homes and take care of them. And I love that I now know that I can turn to you, to my seniors, that vulnerable group that can't get out of their home, to have you come and vaccinate them. I love that my caregivers who some work several jobs and have long days, that now they have a place locally that they can go and get the vaccine, and they can just walk in, because I know for them scheduling, it was difficult before. The other thing that I'm happy to hear that's really going to help our clients is that you do that compliance packaging. And Amy, if you can just touch a little bit more on what that is. I know for my mom, who's in her 90s, she has a lot of difficulty opening those prescription bottles that are childproof, and she asks her young grandchildren to please open the childproof bottle for her. And also, so many of our seniors are on lots of medication. They have to take a high blood pressure pill, and they have to take a heart pill, and they have to take this. And I was visiting with a client the other day, and the amount of bottles on her card table was overwhelming. I'm like, how do you keep track of what to take and when? And I understand that these bubble packagings is a good solution for them. And Amy, I feel like if you could just expand more on what this compliance packaging is and really how it helps your customer.
Sure, absolutely. You're right. The amount of meds that some people are on is staggering. At some point, you wonder, how they're able to keep it under control. So having the nurses coming in and helping a lot of the patients is great. I mean, that's been a very welcome resource for us to have as a liaison. But some of these patients don't really know anything. Like, you call them and ask them questions, and unfortunately, it's just too overwhelming, and it's very hard for them to manage. The way the bubble packaging works is we would take an intake form on a patient. So if a nurse or a doctor's office calls us and asks for a patient to kind of be set up on blister packaging, we would do an intake. We get all their, pertinent information, requests, allergies, things like that, all their doctors. We'd then reach out to the doctor's offices and get their current med lists. From that med list, we would create what we call a demographic, which would break their meds up throughout their day based on the dosing. So our bubble packages have 4 rows in them, which can be designated whatever time, or, that needs to be maybe early morning. Let's say if someone's on a thyroid med that needs to be taken separately, and then morning, evening, and bedtime. We can really kind of design it however it needs to be with that patient. And if someone has more spots than just 4, if they need to take meds more than 4 times a day, again, we can do a double package so that we can do up to 8 spots if need be with 2 different cards. And then in the package itself, in each of those sections, each of the meds that patient is taking would be listed on the front of the bubble pack with how many tablets are in that specific hole. Each card has 8 spots going down. So for a month, the patient gets 4 cards basically, and that would take them for a 30-day supply in 4 cards. So like 3 cards of 8 and then another one of 6. And they're all labeled with the date that they should be taking it. So if we're sending them their bubble pack to start 3 days from now, that would be the first section on the bubble pack with the date on it, so that they can follow along with the time and the date to be able to help them with their medication. And even the patients that have nurses, who come in regularly, they might need that extra help. It's nice to have it all labeled up for the nurses as well, and for the patients when the nurses are attending to other patients.
And Amy, so Visiting Angels is a non-medical home care agency, and our caregivers are not allowed to dispense medicine from a prescription bottle. And so our clients who are on medication and our caregivers, we appreciate that pre-dosed pack so that we can help our clients remember to take their medication and make sure that they do.
There are some medications. It is a great thing to have, because I know that is usually the concern, and they really want to make sure everything is labeled so that they're sure the checks and balances are there, that they're giving the right meds at the right times. Some meds can't necessarily go in the blister packaging, depending upon if it's a controlled substance or something else. But we do also do something called a bingo card. So we can just do the med by itself on a separate card with a label. So for any of those meds, we can send in addition to the blister pack for anything that might either not be able to be contained due to the nature of the medication, or if the nurse may request it, if it's an as needed medication, we can put that completely separate so that they can still dispense it. But again, not in a vial. It would be labeled in a card package format.
Sounds like some really extreme customer service skills.
We're trying. We have a bilingual staff. So our technicians, as well as our pharmacists, we have a variety of languages that we speak: Spanish, Khmer, a lot of different languages to be able to service the needs of the community, which is, very, very popular in the area that we're in. So that's very helpful both to us working with people. If we can't communicate, we have our techs or other people to be able to kind of get that message across. So it's very helpful.
That's great. I know I've said it already, but I am very impressed. And so I think we're going to wrap it up, or kind of like hit our time limit here, unless anyone else has one last question they have on the queue here. So thank you so much for joining us. I know I'll be visiting very soon to come meet you in person. We look forward to sharing all of this information with our networks and help each other get through this and just continue to do the good work that you're doing. So
thank you for having us.